Good morning. Today I'm going to do the female urinary catheterization and removal. So first I have to wash my hands and identify the patient and explain the procedure. Okay, so um, Mrs. Smith, good morning. My name is Daisy and I'll be your nurse today. Today I'm going to insert a catheter on your urinary catheter. Is that okay for you? So I'm going to get my supplies and I will be back. Okay? Okay. So I collected all my equipments and I have my sterile pack for catheterization, a sterile Foley catheter, sterile gloves, and drainage urine bag. And so first, I have to provide privacy for the patient by closing the door and pulling the curtain, keep the opposite side side legs up, and see to it that the bed brakes are on. So, provide privacy for the patient. First, I have to position the patient. So, position to the dorsal recumbent position. So, I have to instruct the patient, "Hi, Mrs. Smith, I'm going to, please, would you mind to keep your knees up and bend? Thank you. And keep your thigh relaxed. Is that okay for you? Okay. Just tell me if you're not comfortable." So, I put my soccer pad already. So, I will do a pericare with soap and water. Perineal care for soap and water needed with the none with the clean gloves. And after, so I have
Yeah.
So I have to open my sterile pack
Stretch my legs. You just want to make sure you're
away from me. So I have to. Yeah. Trash bag. So, Mrs. Smith, I will drape. There are two sterile drapes. So first, these drapes, I will put this under the buttocks. It should be shiny down. Will you help me to keep your hips up, please? Thank you. The big drape. So I will add my catheter.
Oh, this is the bed?
I will urine bag. It should be hung in the bed frame, not in the side bricks. Then I will use my stirrup cups. So what I will do is to, presuming that I tested the balloon for patency, with the inflating this balloon. And I will open this lubricant in the sterile field.
Labia ay ano, non-dominant, meaning
So there is an antiseptic solution. So what I will do is to separate the labia with my non-dominant hand. Separate the labia with non-dominant hand, and so first I will do the majora, labia majora. Then I have to up, down, again labia majora, down, labia minora, in the center. So the non-dominant hand should be separated by the labia. So I keep that lubricant. And direct the urethra. Identify the urethra by asking the patient to, Mrs. Smith, would you mind to take a deep breath or bear down? So you have to insert the catheter 2 to 3 inches in a gentle. Okay. So keep your non-dominant. Until there is a resistance or additional inch. So you have to, the non-dominant hand should hold the catheter, and the dominant hand will, until you have to push the catheter until the urine flows out an additional inch. So, and the non-dominant will hold the urine, the bag, the catheter, and inflate the balloon. Presuming I inflated the balloon 10 cc. Monitor the patient for pain. So, Mrs. Smith, do you have any pain? So, and pinch the catheter. See to it that you maintain sterility with the part of the drainage bag and the urine, the catheter tip, and keep this. and secure them. Catheter. And remove this. So this is the insertion of polycatheter. While for the removal of the catheter is to use the clean gloves and deflate the balloon. So, I will wash my hands and document the nurse's notes that the amount of the urine output, the color, and the date and time, and the patient's reaction. That's it.